हेलो गाइस, नमस्कार। दिस इज सुकन्या एंड वेलकम टू साइकोड्रामा। जैसे कि आप सबको पता है, मेंटल डिसऑर्डर्स को कैटेगराइज करने के लिए हमारे पास दो मैनुअल्स हैं, आईसीडी एंड डीएसएम। तो आज हम डीएसएम के बारे में बात करने वाले हैं। सो लेट्स स्टार्ट।
So, DSM stands for Diagnostic and Statistical Manual of Mental Disorders. It is the manual used by clinicians and psychiatrists to diagnose psychiatric illnesses. It is published by American Psychiatric Association. It contains description, symptoms and other criteria necessary for diagnosing mental health disorders. DSM was first published in 1952. So when we talk about DSM, there are different axial system that was invented while publishing DSM. So the first axial system was multi-axial system, which was introduced in DSM 3. So through these axes, we categorize all of the mental disorders, and it was very helpful for the psychiatrist to categorize each disorder into which axis it should go. From DSM 3 to DSM 4 TR followed this multi-axial system. This includes Axis 1 clinical syndromes, Axis 2 personality disorders and mental retardation, Axis 3 general medical conditions, Axis 4 psychosocial and environmental problems, Axis 5 global assessment of functioning. So there are 5 axes which was introduced then. So after DSM 4 TR, in DSM 5, all of this access system got removed, and there are so many changes which actually come in the paper. Like what are the differences in DSM 4 TR and DSM 5? So we're gonna see that what are the differences in DSM 5. So number one, there was a shift from Roman numeral that we used to write in DSM 4 like DSM IVTR, and now in DSM 5 we don't write DSM in Roman numeral 5, we write in Arabic. And DSM 5 eliminated the multi-axial system. This includes categories of disorders along with a number of related disorders. Changes of each disorder, we will see that in each of the sections of the disorders that we are going to take up. Then DSM 5 TR, that was the next revision. Like this is the most latest revision of DSM which we have right now. But still psychologists are following DSM 5 because there are not very much changes in other disorders. But we still use DSM 5 right now because there was not a very huge gap or very large number of variations between the two. So basically what does DSM 5 TR stands for? The TR stands for text revision, and it contains revised criteria for more than 70 disorders. And DSM 5 TR includes the addition of a new diagnosis called prolonged grief disorder. In DSM 5 TR, social phobia, which we used to write near social anxiety disorder, it has been removed. The term intellectual disability was revised to intellectual developmental disorder. This made significant revisions to gender dysphoria.